Like, how could psychology help with chronic pain? You know, we have the opioid crisis, we have spinal cord stimulators, but how can chronic pain be helped by just talking to a person? It doesn't make sense. Well, we have to go back in time to 1992, just about, where oxycodone was introduced to the field. And during that time period, simultaneously yet independently, the faces came out of the 10 faces that have chronic pain faces. And if you notice, they start out with the smile faces to the left and pain faces to the right. And we read as a culture from left to right. So if you're going to look at these chronic pain faces, you're going to start at the left, and you're automatically going to go to the right. You're automatically going to give a higher rating of pain. And this is done for scientific purposes. I'm not sure why this is done. I try to look it up on the internet, and anyone who could find it, help me. I cannot find an episode of the pain faces reversed, where they start out with the painful faces and go from left to right with happy faces. So you'd say to somebody, so what's your pain scale? And they look at pain faces and, well, I got to go from left to right because that's what we do in our culture. Oh, I guess I'm a 4 or 5. But it's kind of meant to be. So what happens is we're kind of stuck in psychology, and I think that in a lot of our associated fields are stuck saying, what's your pain scale? I say, oh, I'm a 9 today. Oh, I'm a 7, I'm an 8. I'm 11. There is no 11. It's the worst pain I've ever felt in my life. Well, then you do some relaxation breathing, you do some meditation, you do some, so how do you feel now? Oh, I feel a lot better. I'm maybe like a 5 or a 6. Okay, so I guess we got somewhere with therapy. I don't think we did. I really don't think we did psychological therapy. I think we didn't do anything more than physical therapists could do. I don't think that's psychology. You know, in my opinion, psychology is where you change the person's impression about themselves, or you help them draw upon strength that they have within themselves psychologically.